Good evening and thanks for joining us. The good news about a vaccine on the way is being tempered by the reality of what's still happening in many parts of this country. Ontario, Canada's biggest province, has set a new record for new COVID-19 cases in a single day. Nearly 2,000 and 35 more Ontarians have died. Quebec reported more than 1,800 new cases today and 33 more deaths. And in Alberta, more than 1,500 new cases were reported. 13 more Albertans have died. Going into the holiday season and the new year, the picture is nothing to celebrate. In Ontario, the percentage of positive tests appears to be flattening, but projections released today contain lots of bad news. In Toronto, 70% of cases have no epidemiological link. That means it's not known how people got infected. And the projections show hospitalizations, including ICUs and deaths, will all keep rising. The Ontario government has extended all COVID-19 emergency orders now until at least January 20th. Eric Sorensen has our top story tonight.
COVID-19 has swept into this London, Ontario hospital. More than 140 positive cases, half among patients, half among staff. In Mississauga and Toronto, smaller outbreaks across a network of 3 hospitals where at least 36 staff and several patients have tested positive. And while outbreaks are a problem in some hospitals, many face another challenge: space. A hospital network in York Region has declared it's at a tipping point in managing COVID-19 volumes. Across the province, 1 month ago, the number of COVID patients in hospitals and intensive care units was manageable. Since then, hospitalizations have almost doubled, and the number in ICU beds has almost tripled in 1 month. What now?
You could see a rapid movement amongst hospitals to have to start making more beds. And what that means is basically starting to cancel elective surgeries.
The basic problem remains: rising COVID-19 cases. They hit 1,350 per day on average last month. Worst case projections warned of 6,500 cases by now. A partial circuit breaker, new restrictions in hot zones, has helped flatten the curve somewhat, but numbers have still climbed to more than 1,860 cases a day on average, 500 more than a month ago.
We're bending the curve a bit. As the data shows, we are slowing the rate of increase, but we have to do better than that.
That's because rising cases will lead to still more hospitalizations. The number of ICU beds in use over the last month not only topped 200, it will stay above that threshold till January at least. And the projection for even small percentage increases could see demand for ICU beds approach 300, or worst case, 500 ICU beds.
You can see how the system requires a bit of breathing room in ICU beds in case of emergencies. And what COVID patients are doing is they're eating into that breathing room to the point where already there's almost none left.
One hopeful development: starting next Tuesday, Ontario will begin administering vaccine doses in Toronto and Ottawa. But initially it will amount to a trickle of protection as COVID-19 cases and hospitalizations continue to rise. Eric Sorensen, Global News, Toronto.
The 2 vaccination sites in Ontario will be the Ottawa Hospital and the University Health Network in Toronto. Starting on Tuesday, December 15th, the first doses of the Pfizer-BioNTech vaccine will be given to healthcare workers in long-term care homes and other high-risk places.